Okay, I'm D.Kirsten, cohort 7. This is my 10-minute head-to-toe assessment. The first thing I would do is observe the patient walking into the room, noting their ambulation, their gait, their ease of movement. Next, I would shake their hand, noticing the firmness of their grip. I would check their name tag and ask their name. What's your name?
Aaron Kirsten.
And your date of birth?
10/27/92.
And today's date?
December 13, 2009.
Great. Do you have any allergies?
No, I do not.
I'd introduce myself. I'm Dennis. I'm a student nurse. I'll be doing your assessment today. Next, I would do vital signs. I would do blood pressure, temperature, and I would check the radial pulse. For 1 minute. I'd also check it bilaterally for amplitude. Make sure they're equal. Great. Okay, then I'm going to go into the shoulders. I'm going to palpate the shoulders, the arms, any tenderness, any fluid in the joints, the elbows. Look at the skin integrity. Notice any pitting edema. I'd look at the hands, the knuckles, the fingers, and check for capillary refill, which looks good. I would do that bilaterally. Next, I'm going to palpate the head. I'm going to check for tenderness, the contour of the head, the hair distribution, check the hair itself for integrity, and then I'm going to palpate the temporal pulses. Next, I'm going to check and palpate the sinuses. Any tenderness?
No.
Any tenderness?
No.
Good. I'll palpate the lymph nodes. Good. Okay. Next, we're going to check the eyes. We're going to look at accommodation. Good. I want you to look at the tip of this. Follow it with your eyes only. Check the gaze. Good. Look at the tip. Look at the wall behind me. Look back at the tip. Very good. Okay, next we're going to palpate the ears for any nodules. We're going to look at the ears, the external ear. We're going to look at the eyebrows, the ears, make sure everything's symmetrical and level. We're going to look in the nose. Bring your head back a little. Flare your nostrils. Turbinates look good. They look moist. No deviated septum. We're going to look in the mouth. Open your mouth real wide. Bring your head back. Look at the teeth. Lift your tongue. Good. Lower your tongue. Say ah.
Ah.
Good. Tonsils and gag reflex look normal. Okay. We're going to have the patient take a little sip of water. We're going to palpate the thyroid gland. Don't swallow yet. Go ahead and swallow. Great. We're going to palpate the carotid arteries. One at a time. Good. Okay. And now what we're going to do is look in the ears. I would do this bilaterally. The ears look normal. Tympanic membrane is gray. Going to check the red light reflex. Good. Look straight ahead. We're looking inside the eye. Looking at the disc, the margins, the arteries, and everything looks normal. I would do that bilaterally. Okay. We're going to check now range of motion. Bend your head forward and backwards and to the sides. Okay, and twist your head. Good. Okay, push against my hand, to the back as hard as you can, to the side, to the other side, and then try to turn your head against my hand and the other way. Great. Bring your arms up like this. Raise your wrists. Don't let me push down. Bring your wrist down. Don't let me lift up. Checking muscle strength. Don't let me push down. Bring your arms in like that. Don't let me pull out. Good. Bring your arms straight out. Don't let me push down. Curl your fingers around mine. Don't let me pull them out. Spread your fingers apart and don't let Push them in. Put the hands down. I want you to lift your shoulders or shrug them. Excellent. And we're going to check reflexes. We would do this bilaterally. Relax. Good. Excellent. Good. Reflexes are 2+. And relax your leg. Check your patella. Good. Okay. And now we're going to auscultate the lungs. So when I touch you with the stethoscope, take a deep breath and blow it out. Okay. Check anteriorly. Take a deep breath. Lift your arm low. Good. Lungs sound normal, no rhonchi, wheezes, or rowels. And now we're going to auscultate the heart. And the heart sound is normal. Now we're going to palpate for the PMI. Great. Okay, can you lie down on your back, please? First thing we're going to do is auscultate the abdomen for bowel sounds. Bowel sounds are present. Check for any bruise. Check the vascular sounds. Good, everything sounds normal, no vascular sounds. We're going to check pulses, femoral, popliteal, posterior tibial, dorsalis pedis. We're going to observe the legs for any lesions, deformities, abrasions. Now we're going to check muscle strength. Hold your leg up, please. Don't let me push down. Don't let me lift up. Bring the leg back to your thigh. Don't let me push back. And don't let me pull forward. Bring the leg all the way down. And bring your foot back. Push against my hand. Good. Bring your big toes back. Don't let me pull forward. Great. And that would conclude our 10-minute assessment.